Have you ever been on a blind date? You tend to hope for the best, but fear the worst. You hope she'll look like Audrey Hepburn and have a beautiful personality, but she might look nothing like the way you like, and she might have the personality of a Rottweiler with rabies. It's the same when you have a new doctor or therapist. You hope for the best, but fear the worst. You hope for a doctor to be a wonderful person, very knowledgeable, very dedicated to the job, but you might get the next Harold Shipman. He's the guy that healed 300 of his patients. So what is it that people look for in a doctor when they meet them? What is it they want to see? It's not really the knowledge or skill or expertise so much, because that's kind of assumed. If they have a medical license or a chiropractic license or whatever license they have, then they know their stuff. They're qualified and they do regular seminars to keep qualified. So you think, well, they should know what to do, but it's, do they care? Because some doctors care more than others. And you feel that very acutely as a patient. If the doctor rushes you, that's a bad sign. If they don't seem particularly interested in you or your concerns, that's a bad sign. What you want is for the person, first of all, to get to know you, to ask a few questions about who you are, what you like, what you do, what's wrong with you, and how is it interfering with your life, and what does it stop you doing, and how has that affected you, that kind of thing. And then you want to ask loads and loads of questions about the condition, what makes it worse, what makes it better, how did it start, what other factors are there, and your past medical history as well. When they've done all that, they should examine you, and very, very thoroughly. Everything should be checked, not just the part that hurts, but your whole body. Check everything just in case. When they've done that, they may want to do some blood tests or some x-rays or some scans or something. And when they've done all that, they should sit you down, possibly on the next visit, and say, right, this is what's going on, this is what's caused it, this is what we think we need to do, and then sit down and show you the x-rays or scans and say, this is why you're suffering, because this is doing this or that's doing that, and talk you through it very, very gently so you understand exactly what's going on. Because when you understand what's causing the problem, that's half the battle, because then you're motivated to do the exercises, to do the lifestyle changes and get better. And when you find a doctor like that, it's really good, it's very satisfying, and you go away with some hope that you're going to get better. Hugely important. If you get rushed out without really knowing what's going on, it's quite deflating, especially if it's a long time between visits. So good luck in finding the right person. If you go somewhere and you're not happy with them, go somewhere else. Find someone that you have a good rapport with, that you respect, that you have some trust in, that seems to really care. Because if they care about you and they know what they're doing, the chances of your getting better are massively increased. So good luck with finding the right person. Thank you very much for listening.